Hello guys, welcome to the Cortex Medicine and I am the bogus doc. ये क्वेश्चन आया था एक PYQ प्रीवियस ईयर क्वेश्चन दी INICET मई 2025 उसकी इनिशियल गाइडलाइन उसके अंदर एक सर्वाइविंग सेप्सिस गाइडलाइन के ऊपर क्वेश्चन था, ठीक है। सो दिस लेक्चर इज ऑल अबाउट दैट. I am reading the important point of that guideline. Okay. For the patient comes in septic shock and with patient with hypotension, आपको सबसे पहले fluid resuscitation देना है, okay, and prefer the crystalloid, and in the crystalloid you have to prefer ringer lactate, okay. The dose is 30 ml per kilogram IV within the first 3 hours for the septic shock. यहाँ पे क्या है कि कई सीनियर होंगे, जब आप प्रैक्टिस करेंगे, कब जब आप रेजिडेंसी में जाएंगे तो वहाँ पे क्या करेंगे कि दे विल टेल कि सेप्टिक शॉक में पेशेंट है, आपने इनिशियल डोज 30 ml पर किलोग्राम आईवी दी या नहीं दी। तो यहाँ पे ये अपडेट है कि इट इज ए वीक एंड लो रिकमेंडेशन डोज, ओके, नॉट हैव टू गिव इन द एवरी पेशेंट, सिंपल. फर्स्ट थिंग, antibiotic admission should be given in the first hour if you suspect it is a definite, okay, definite that this is the sepsis, okay, in the within first 1 hour. The recommendation for the antibiotic we will read later. So vasopressor for persistent hypotension patient, what is the drug of choice? It is the drug of choice, or what is the first line? It is the norepinephrine, that is the first line vasopressor, uh, okay, with a mean arterial pressure of more than 65, okay. And यहाँ पे कि what can be the added further, it is the vasopressin that can be added further if blood pressure remains low despite adequate fluid resuscitation, okay, added to norepinephrine. This was the, I think, the PYQ in the PYQ INICET May 2025, okay. This was the question. Next, it is used in combination with norepinephrine and not as first line. Remember this, okay? It's not like कि आपने पहले vasopressin start कर दिया and then norepinephrine. It is wrong. You first have to start norepinephrine. If patient is not improving or not maintaining mean arterial pressure of more than 65, you have to go with vasopressin. You have to reassessment of fluid status, okay. And lactate monitoring, if in the initial lactate is more than 2 millimole per liter, continue monitoring to assess, okay, is you have to do it, okay. Source control means control the infection source, okay. Additional recommendation, steroid is recommended, yes. Low dose corticosteroid hydrocortisone 200 mg per day IV can be used in case of septic shock that remain refractory to fluid restoration and vasopressor therapy, but should not be routinely used for all patients, okay. Sedation analgesia, if patient is mechanically vented or blood glucose control is important, you have to maintain the blood glucose between the 180 to 200 to 220, and tight glucose control is not recommended, okay. So what are the screening tools you can use? Like we earlier used SIRS, but recently the Q-SOFA is also used. So surviving sepsis guideline is told that Q-SOFA is no longer recommended as a standalone screening tool for sepsis or septic shock. Now suggesting a combination of tools such as SIRS, NEWS or MEWS for early identification of sepsis. You know the SIRS. Now let's learn the NEWS and MEWS criteria. Just remember, more than 5 in the NEWS is the considered to threshold to trigger urgent clinical response, and more than 7 in the NEWS high risk for clinical deterioration and possible sepsis. You are doing a troponin scan. I included that because it's not so hard to remember this. Okay, troponin scan, trop scan, temperature, respiratory oxygen saturation, pulse, systolic BP, consciousness, and need for oxygen, and national early morning score, and for the Muse mnemonic is he really seems too cold. Okay, heart rate, respiratory rate, systolic blood pressure, temperature, and consciousness. Okay. Then Muse more than 5 typically indicates need for urgency assessment. Okay, these are the optional, you have to remember, not it depends on our. I don't think यहाँ से क्वेश्चन आना बहुत ही हार्ड है, बट इंक्लूडेड दीज क्योंकि मुझे कुछ इंपॉर्टेंट लगा, ओके। इसके बाद आया कि इनिशिएशन ऑफ एंटीबायोटिक कैसे करना है आपको, ठीक है। शुड बी यूज्ड विद इन 1 hour ऑफ रिकॉग्निशन, ओके, इंपॉर्टेंट पॉइंट, ओके। इसके बाद है कि इसके बाद इसने बोला कि सेप्सिस आपको लग रहा है कि डेफिनेट और पॉसिबल है, तो आपको करना है एंटीबायोटिक इमीडिएटली विद इन 1 आवर ऑफ एडमिनिस्ट्रेशन। ठीक है, अब आपको लग रहा है कि नहीं भाई डेफिनेट और प्रोबेबल नहीं है, पॉसिबिलिटी है कि भाई सेप्सिस हो सकता है। ठीक है, और यदि पेशेंट शॉक के अंदर है, क्या बोला मैंने, एक पेशेंट को आपको लग रहा है कि डेफिनेट है और प्रोबेबल है, तो आपको क्या करना है जी, शॉक प्रेजेंट है और एब्सेंट है, आपको विद इन 1 आवर के अंदर एंटीबायोटिक यूज करना है। इफ यू थिंक दैट कि सेप्सिस पॉसिबल है सेप्सिस की, तो आपको करना है, यदि पेशेंट शॉक में है तो विद इन 1 आवर, और आपको लग रहा है कि नहीं शॉक एब्सेंट है, तो आपको रैपिड असेसमेंट करना है इन्फेक्शियस वर्सेस नॉन इन्फेक्शियस कॉज ऑफ एक्यूट इलनेस, एंड विद इन 3 आवर के अंदर आप कर सकते हो इफ कंसर्न फॉर द इन्फेक्शन परसिस्ट। ओके, लिखा हुआ कि फॉर एडल्ट विद पॉसिबल सेप्सिस विदाउट शॉक वी सजेस्टेड टाइम लिमिटेड कोर्स ऑफ रैपिड इन्वेस्टिगेशन एंड कंसर्न फॉर द इन्फेक्शन परसिस्ट, the administration of antimicrobials within 3 hours from the time when sepsis was the first recognized। जब आपने सेप्सिस को रिकॉग्नाइज किया विद इन 3 आवर्स, इसका भी वीक रिकमेंडेशन है, इतना कोई हार्ड रिकमेंडेशन नहीं है। ठीक है, अब बात करते हैं यहाँ पे 2020, ये जो गाइडलाइन थी 2021 की थी, 2024 के अंदर ये सोसाइटी ऑफ क्रिटिकल केयर मेडिसिन ने न्यू क्राइटेरिया दिया सेप्सिस एंड सेप्टिक शॉक के अंदर चिल्ड्रन के अंदर, और उन्होंने एक स्कोर निकाला द फोनिक सेप्सिस स्कोर। ओके, what are the I think this can be a question। okay, what are the point that can be included in the phonic sepsis score? It is the respiratory, ठीक है, PO2 and the FiO2, okay, or SpO2, what can be, it is the respiratory, it is the cardiovascular part, it is age based mean arterial blood pressure, okay, the coagulation, ठीक है, by the coagulation by the platelet, by the international normalized ratio, d dimer fibrinogen, the neurological। okay, done। okay, so important, you have to see the 5 things: respiratory function, cardiovascular function, age based mean arterial BP, coagulation, and neurological। okay, so the phonic sepsis criteria told that the sepsis is diagnosed as when the suspected infection phonic sepsis score is more than 2 points, and septic shock when the sepsis means with more than one cardiovascular point। okay, these cardiovascular point, okay, these one sepsis that include one cardiovascular point। okay, this is the septic shock। okay, so these are the guidelines that sepsis in children with suspected infection now defined as a phonic sepsis score of at least 2 points, indicating life-threatening organ dysfunction of the respiratory, cardiovascular, coagulation or neurologic system। okay, respiratory, cardiovascular, okay, it is also depend BP, blood pressure is also there, cardiovascular, 2 things included। Children meeting the criteria included those with organ dysfunction limited to primary infection and those with primary site of infection remote। Septic shock, sepsis with one cardiovascular point, more than one cardiovascular, and no more severe sepsis। okay, remember this, no more severe sepsis with this new criteria, every sepsis is severe by itself। okay, now the surviving sepsis guideline, I told you the antibiotic, these are the important point, this is the better। okay, slide, and for the vasoactive agent, use of norepinephrine I told you as a first line vasopressor, target is mean atrial pressure of 65 mmHg, consider invasive monitoring of arterial blood pressure, these are the low guideline। okay, not, it is the weak recommendation। okay, consider initial vasopressor peripherally, always think that if someone is you are unable to access the central line, you have to save the life and you have to use the vasopressor from the peripherally। okay, but for a short period of time in a vein proximal to the antecubital fossa। okay, consider adding vasopressin। okay, and consider adding dobutamine or switching to epinephrine if cardiac dysfunction with persistent hypertension present despite adequate volume stimulation blood pressure। okay, so these are the guideline, I think I covered most of the points from these guideline, and most of the question will solve from here। thank you, keep following, keep sharing।